Carrie, I know parents that have children with autism face a lot of choices. They have a lot of things that they have to think about. There are a lot of worries and a lot of processes that are new for them. Sometimes at staffings, they're faced with a choice of what language are we going to use in therapy? What language do they want their child to communicate in? If they're bilingual, what would you say to them? What should they think about before they make a decision to use maybe one language rather than another, or to do therapy in both languages, or maybe to eliminate a language and focus on the language that the school uses? What would you say to them about that?
You know, this is something that families that have more than one language in their home, or when the home language is not the language that's used in the academic setting, who have children with autism face all the time. And I think, unfortunately, very well-meaning professionals are still giving the recommendation that we should use simplified language. And we can still agree that if we're talking about simplified language and the fact that students with autism may have difficulty understanding, say, idioms or things that aren't literal, concrete language, I do agree with the simplified language recommendation. However, sometimes simplified goes one step further to indicate only using one language, which usually means the language that's not the language of the home, but the language of the academic setting. And with this, we can draw from some of the research that's been done with children with specific language impairment or other language impairments that show us that when you do add a second language, there are not negative effects to the first language. However, we do know that when you eliminate the first language, that it does have negative effects on the second language. So given this, we can think that the same would be true for children with autism, who also obviously have deficits with developing language. Another thing to consider is that at home is where children do a lot of their socialization. They not only learn about how to socialize through the modeling of their parents, of their siblings, and other relatives who are part of their lives, but they also get the chance to practice that type of social language and pragmatic rules. What sometimes happens, again, very well-meaning families who take out the use of the home language when they're speaking with their child, they may be actually isolating their child from some of these very important communicative interactions that could be helping them in an area that we've historically known to be an area of deficit. So I would not only say that we have reason to believe that being bilingual and a student with autism might actually be a benefit to that student, and not using the home language could actually be more detrimental to their overall speech and language development.
Carrie, thank you very much for coming to talk to us today.
Oh, it was a pleasure to be here.